Closed captioning for Lakeland Currents is supported by the Minnesota Department of Commerce, Telecommunications Access Minnesota, and Nisswa Tax Service. Nisswa Tax Service, tax preparation for businesses and individuals. Across from City Hall in Nisswa and online at nisswatax.com.
Imagine that you have health insurance, very good health insurance, and you become ill. And you go to a doctor, and the doctor can't figure out what's wrong with you, so he decides that you need to go through a battery of tests. And you go through tests and still can't figure out what's going on. Finally, after about 2 weeks of tests, the doctor's determined what's wrong with you. And about 3 weeks later, you get a statement from the doctor or from the hospital, and the statement says, this is not a bill, because you've got insurance. And you open up and you say, wow, this isn't a bill, this is a down payment on a castle. How could that possibly be that this costs so much? Well, the scenario could even be more dramatic if you have a $4,000 or $5,000 deductible. Or, as our Annie Cook shows us, it could be that you have no insurance or very, very poor insurance.
It's just going to be one of those days for Bryson Berg, because with help from the Crow Wing County Public Health Department, his mom is getting him caught up on his immunizations.
We hear these stories of parents saying, you know, my child needs their vaccinations. What can I do to make sure I get him vaccinated without having to incur the cost?
Affording medical procedures is tough for an ever-growing number these days, so many people forego treatment and checkups.
As a result, people, when they do present to the emergency room or to their physician, will typically be more ill when they finally do show up.
And this delayed treatment contributes to the rising medical costs. While the price of health care is dependent on many issues, medical professionals all agree that preventative care will save the system money in the end.
It's been proven time and time again that preventative care is significantly cheaper.
If you have a limited medical budget, you can still prevent major illness. The state is even helping out by looking into a healthy living initiative.
I think it will be very beneficial for the state of Minnesota to ensure that all Minnesotans have the same opportunities for health.
But people have to do their part. Eat well, quit smoking, get active, and take advantage of the reduced price programs out there.
If you're out of work for 10 days to 14 days, spending $15 for an influenza vaccine is dollars well spent.
Also, many clinics are willing to work out payment schedules, so you can still go in for recommended procedures like dental care and yearly mammograms.
I would definitely have a discussion with the clinic billing department, business department, and just telling them straight up, right up front, that I'm not able to pay for these services right away. I need a billing plan.
You can't prevent all illnesses, but you can be proactive in keeping you and your wallet healthy. For Lakeland News at 10, I'm Annie Cook.
Welcome to Lakeland Currents. And our topic this evening, by the way, this is our first edition, and we're very happy to have you on board. Our first topic this evening is about the cost of healthcare, the high cost of healthcare, something that affects each and every one of us. And I'm very honored to have a very distinguished panel here this evening to talk about what some of these drivers are that are creating these high costs. Our first, to my right, I'd like to introduce Janie Wiebold, who is the President and Chief Executive of St. Joseph's Medical Center. And next to her is Dr. David Baran, who is the Chief Medical Officer for Brainerd Health. And to his right is Tim Rice, who is the President of Lakewood Health Systems. I might add that both of these hospitals are regional hospitals with outreach clinics in neighboring communities, so they cover a pretty large area. And Janie, you've been kind enough to start this discussion off to give us some overview of what's causing these costs to rise so dramatically.
Well, thanks, Ray. I thought it might be helpful. I know we want to spend most of the time on really talking about the drivers, but I think it would also be helpful maybe to start with just a brief overview about that really gives a flavor for how much are we spending, what are we spending it on, how much is it increasing, how do we compare to other countries, and who are we spending these healthcare dollars on. And probably one of the most significant statistics that I read is that 16% of our entire U.S. economy is devoted to healthcare. And its growth has outpaced the growth in the economy. The growth of healthcare expenditures has outpaced the growth in the economy every year since 1970. And today we spend an average of about $6,600 for every man, woman, and child in this country on health care. And just 3 decades ago, in 1970, that number was $356. So you can see from that perspective that the growth in health care in our economy is really significant. And then you compare and contrast what we spend in this country in comparison to other developed countries. And just as an example, well, what we spend in the United States ranges anywhere from, we spend anywhere from 13 to 90% more than other developed countries. And if you take the United Kingdom, for example, they spend about $2,000 per person on health care, and again, ours is more than $6,000. And many of the measurements that we or many of the things that we measure to determine the overall health of the population certainly doesn't suggest that the status of our population is 90% healthier than those other countries who may spend less. So we spend more than those in other countries. Another significant factor is that a very small share of the people account for a significant amount of the healthcare expenditures. About 50% of all the money we spend on healthcare goes to treat only 5% of the population. And healthcare expenditures grow significantly as we age. So a 17-year-old, for example, we on average spend about $1,000, an 80-year-old about $15,000. And that certainly is significant when you think about the fact that as a population we're aging. We are living longer. And particularly when you add that bolus of baby boomers into the mix, you can see where healthcare expenditures would really, really increase. About 52% of all the money that we spend on healthcare goes for hospital and physician care, and the rest is spent on other things like prescription drugs and nursing home and home health care and other kinds of miscellaneous expenses.
I read recently where with the recession that we're in, healthcare and education are the only 2 growth industries right now.
Yes.
Which is really fascinating. I also read that of all the people who are going unemployed, if they have health insurance, they're spending 30% of their unemployment benefits just to keep that insurance intact.
Just to keep the insurance.
Which is pretty dramatic.
Yes. Now on the positive side, the investments that we've made in healthcare over the last 25 years have actually brought us some value. And another interesting set of statistics is since 1980, death rates have decreased 16%. Life expectancy has gone up between 3 and 4 years. Disability rates for people 65 years of age and older have gone down by more than 25%. And we spend 56% fewer days in the hospital. So some of the investment we've made has really benefited us. But again, as you look at projecting those increasing costs out over time, we have to find different ways of dealing with maintaining health.
I think that statistic you gave about healthcare, going to the doctors and the hospitals itself, is probably much lower than most people would expect. Mm-hmm. I think most people think when they drive by the hospital and they see 80 doctors in the hospital, they think that's where all of it's going. That's far from reality, isn't it?
Yeah,
it really is.
It's surprising when you think about it's true, most people do focus primarily on physician and hospital care, and it is, hospital care in particular is very high cost, but it still only consumes about half.
Mm-hmm. Very interesting. What is the outcome of all the new technology that we have? How is that a driver? It certainly is a driver, but do you have any idea what percentage of our costs are going up because of technology?
Well, there's some argument about that. Some experts say that technology, in terms of long-term growth and spending, is responsible for as much as 50% of that long-term growth. But you also have to weigh the positives with the negatives on that. The reason that patients are living longer and spending less time in hospitals is largely the result of new technologies and new medications and treatments. So it has a kind of a balancing, well, I mean, you can argue it may not strike a balance, but it certainly has advantages as well as costs associated with it.
Dr. Brand, you made some comments when we talked earlier about our country prolongs life as long as we can, but there are other countries that have a different approach to that. Could you just talk a little bit about that?
Well, I think that's a cultural issue. I think in our country, we have, because of our technology and because of advancements in healthcare, people are living longer, and they don't have so many, don't die as frequently of acute sudden death as they do of more chronic illnesses, cancer, dementia, and pulmonary disease, emphysema, that sort of thing. And as we care for people, we try to provide state-of-the-art care. But at some point in time, there is, a need to recognize when you get to the point where care is futile, then a decision has to be made, and that's a difficult decision. And I think it's a societal decision as well as a personal decision. We spend sometimes the most amount of money in a person's lifetime in the last year of their life for Medicare age elderly people. A lot of resources can be put to caring for some of these illnesses. And it's very difficult to know when to stop. That's a decision that individuals and their families and their physicians need to have a conversation about, preferably, before a crisis. It's always difficult in a crisis to, ask the question, how do you want us to proceed? But that's the job of physicians in all areas, but more and more in the hospitalist field and primary care. And I think that we have, to some extent, we're a victim of our successes too. If you take the field of cardiology and the development over the last 15, 20 years of the care for people with coronary disease, people are living longer, they're living better because of the advances. Not only the technical advances, the coronary bypass, and then the angioplasties, and now the stent development of keeping arteries open, but drugs that are used, the statin drugs and other drugs that are used to manage heart disease. People are living longer. And in my experience, I've seen this many times where people have survived heart disease only to live another 5 or 10 years and then develop cancer or dementia or other chronic conditions that consume a lot of health resources. And you ask yourself, well, was it worth it? Most of the time people say, yeah, it was worth it.
Sure.
I had another 10 years of good life.
Absolutely.
But there are expenses associated with that.
Tim, what's your perspective about the drivers of driving up
Well, I just
health
think,
cost?
what they're all sharing is just all these factors about rising costs, the concerns about what things cost, and technology, and as we age. But I think it gets to the point of just the overall issue about people's perception that healthcare is a right, and the consumer demand of what they expect. When their family, I know they're concerned about cost, but when their family is ill or there's a need, they want everything done, and it's important that that there's access and they have available the latest technology. I think in the past there's been attempts to limit access, and those have been met with great resistance. So there's all this concern, but yet when it comes down to their family and what they expect, they don't want any restrictions as far as the public. So I think society has some really tough challenges to face about, they want it as a right, but along with that there's a cost. And that's something we're all going to have to address.
I think that is an important point in that, if you compare and contrast that with other countries, as Dr. Bourne said, the physician's role in this country is to lay out the options and families and patients choose. In other countries, they don't always have that choice. In some countries, depending on your age and the illness that you're diagnosed with, you may not have the full array of treatments available to you that you would in this country. And I think, Americans want to have full choice. And what Tim alluded to is, in the 1990s, insurance companies developed managed care plans that tried to restrict access to certain specialists or certain types of treatments. And where patients or people had the financial resources and the choice available to have either a managed care insurance policy or a free choice or a policy that allowed unrestricted access to services, they generally chose the unrestricted access. And we all did that. But that's typically our perspective in this country, is that we want to have the full array of choices available to us.
Go
I
ahead.
was just going to say, just to add to that, our health insurance industry has, to some extent, insulated individuals from the real cost of health care. We pay a premium on a monthly basis, and then, we expect care for that and expect it to be paid for by the insurance company. In 1965, Medicare was developed, and it was for the care of illnesses for people over 65. And they didn't include in that preventive services like annual physicals. And in 1965, there weren't a lot of screening tests and things like that we have now. But as time went along, and as the population aged, and as the cost of that care escalated, Medicare began to reimburse physicians and hospitals and all health providers less and less. Well, those costs didn't go away, so they got shifted to private insurance. And for a period of time, private insurance bore that cost, and then they began to raise the premiums to the point now where a lot of employers can't afford the premiums. And we've tried different things like managed health care and other things to rein in the cost. But I think that until recently, I think our public in general has been insulated from the real cost of what it takes to, and consequently tend to use the healthcare system more frequently.
I think you've all talked a little bit about this, that there are uninsured folks that have to have access to the hospital. And when they come into any of your hospitals, you have to take care of them. And those costs get spread out to the rest of us, I'm assuming. But you also have talked about the fact that 30%, sometimes 30% of your costs are not reimbursed by anyone, and you have to eat that within your own system. Would anybody like to talk a little bit about that?
Well, when you receive a bill, you're just assuming, that we get paid, if we charge $1, we would get $1. But primarily for medical assistance and Medicare, it's probably about 50 cents. With other insurance plans, depending on what you negotiate, there's different reimbursement. But pretty rare on anything that we do not get for every $1, we get every $1 back. On average, for every $1 we charge, we get about 65 cents.
So how do you make up that difference?
Well, it goes back into the rates. It's almost like a hidden tax.
Okay.
So really everything is, you still got cost to pay for.
So your doctor visits, your technical x-rays, all of those sort of things.
You still have the cost to provide care. That's all built in, and really who ends up paying for it? Everybody does, but it's the private insurer, the self-pay patient. They all have to absorb those costs, but it's really hidden and people are not aware. And I think the other one too is, I don't know if people are aware, we also pay a 2% provider tax. And that goes down to help cover Minnesota care. But
and where is that? Is that billed just
that's
across?
All in the rates too.
It's built in your rates
there too.
For everything you do.
Yeah, so those are all built into the cost of patients.
I've read where there are 48 million Americans without health insurance, and I'm sure that figure can move around, but that's, you look at Minnesota's population of 6 million or a little bit, either way, that's a phenomenal amount of folks that aren't insured that the rest of the folks are picking up. I'm really struck when I go to a hospital now. I look back to the 1960s, it's cost $148 for the average person for insurance. I remember as a little child calling the doctor to come to our house in a black bag. And it's just amazing how we have gone from $148 to close to $7,000 per person now. The thing that I'm struck by is when we walk into your hospitals, it's almost like starting to go into a hotel. You have a completely different philosophy about taking care of people who are ill. Would anybody just want to talk a little bit about how that's evolved, because it's not unique to your hospitals?
Well, I think they kind of mentioned it, but we're driven by payment systems, and we're driven by consumer demand. I think one of the reasons, though, that we've remodeled, though, is healthcare has changed. Everything used to be more inpatient. Now everything is outpatient. We've, a lot of new services, new technology. You mentioned all the different types of new screenings. So we've had to adjust our buildings to meet those needs. But also, too, I mean, right now, looking what consumers want. I mean, nobody wants to be in a 4-bed ward anymore. I mean, they want a private room. They want birthing rooms. I mean, we're responding to what our consumers want. And then how we're paid in the system now today, we're paid to do procedures, not prevention. But I think those are pointing out some real important questions that need to be addressed. But right now, we're trying to be responsive to meet the needs of our patients, and that's why we're doing it.
And I don't think our region's probably any different than any other regions. There's definitely competition within these regions for those customers. Would that be a fair thing to say, like there is probably in any other business, if you go to Walmart or whatever? And how much is that driven by what you do differently?
Well, I think there may be some, but one thing that I really think that's special about this whole region is the healthcare facilities around here are really focused on making sure we're ensuring care and access. So I don't think that's really a major issue as much as really trying to make sure that the issue of the uninsured and meeting the health needs of our community. I know that's if you look at our missions, we're very focused on meeting the health needs of our community. So I think it's more of what we're driven for.
I agree with that. I was just going to say that I think that when you survey patients about what's important to them with regard to health care, one of the things that's always a theme is that they want to get, assuming quality is equal, they want to get their health care as close to home as they possibly can, where they're as near as possible to their family and support system. And so I think it's very appropriate for patients to want to see development of healthcare services within their own communities. I think it's a positive thing.
Doctor, could you tell us some of the things that people can do to improve their chances of not having to spend so much money on health care? And I know some of these aren't going to be glamorous, but they are difference makers in our lives.
Yeah, that's for sure. I think that there are a lot of, I wouldn't say simple, but perhaps obvious things that we can do. We can stop smoking if we smoke. 17% of our population still smokes. It's down, I think, from about 25% in the mid-90s, but still that's a large number of people that smoke, and there are many, many diseases that are associated with smoking. Responsible use of alcohol, weight loss and exercise, very important. Making sure that your immunizations are up to date, not only for children.
Is that a problem?
Oh, it is.
It is?
And more and more, I think people are being immunized, but there are still concerns among small segments of the population about the safety of immunizations. And unfortunately, we have done so well with that over the years that we don't see the effects of measles, mumps, Haemophilus influenza, which is an illness that was pretty common when I was in training, but since the development of the Hib vaccine is pretty much gone. Polio. I grew up in a time when I knew people who had polio, You never see that in this country anymore. But a lot of times people who never have experienced that have no idea what that was like. You know, sometimes hold off on shots. But adolescents and adults need to make sure their immunizations are up to date. We recommend people get flu shots every year. People with chronic diseases, it's very important. So updated immunizations, and then taking advantage and keeping up with age-specific health screenings. Talking about pap smears and mammograms, and generally there's more screenings as you get older. Colon studies for colon cancer prevention, things like that, that are important. And they do detect the disease early, and they often will prevent disease. Treating high blood pressure.
Still a hidden killer, isn't it?
Yes, and it's not a real glamorous area. It's difficult sometimes. Sometimes takes more than one pill, but it is makes such a big difference in long-term health. So those are things that are kind of top of mind that people can do themselves.
I think that the governor's budget is proposing that maybe 85,000 Minnesotans may lose their health insurance. Mm-hmm. If that turns out to be true, that will be another additional cost, I would guess, for the rest of our population. So it'll be interesting to see what our current legislature and governor does, and also what we do at the national level with the new administration. And we agreed not to talk about solutions because I don't think any of us pretend to understand what those solutions would be. But it'll be great to see that if something happens, we need to make a change to what we're doing, that's for sure. I'd like to thank you all for being on our first show. I think it's a very important topic. And for viewers who are interested in giving some feedback to the program this evening, you can go to currents@lptv.org. And we'd love to hear from you, and we'd love to hear comments about our future shows. And you've been watching Lakeland Currents, where we're talking about what you're talking about. I'm Ray Gildow. So long until next time.